life can be complicated. The full expectation and preparation for one version of future events becomes a complete 180 in the blink of an eye.
On Wednesday, my right calf was kind of sore. I mean, it wasn't like, oh, it's painful. Oh my gosh, what's going on? It was just kind of sore. So I called my doctor and they called back and said it's probably nothing, but you should get that checked out. When I was in the emergency room, the nurse, she says, I'm telling my colleagues that I've got a patient with 3 blood clots in them, and he doesn't look anything like a patient with 3 blood clots on him. To which I said, well, what does a person with 3 blood clots look like? And she says, they're usually dead.
How do you anticipate the gravity of a sudden dire circumstance while on the road to recovery from a previously life-altering event? How do you prepare or attempt to expect the unexpected?
Every 6 minutes, somebody in America dies of a blood clot.
We're here to change that statistic. Welcome to Taking a Breath, a Stop the Clot podcast.
A podcast dedicated to bringing awareness of the dangers of blood clots from the clotting disorders community to the world.
With the help of many notable blood clot survivors, we are here to give you the knowledge and the skills that you need to prevent this silent killer.
My name is Leslie Legg. I am the president of the National Blood Clot Alliance, and I am a blood clot survivor.
And my name is Todd Robertson. I am the patient engagement liaison for the National Blood Clot Alliance, and I am a 7-time blood clot survivor.
And we're here to stop the clot. As blood clot survivors, we know the fear associated with a close call, that dreaded diagnosis that provides a bitter mix of clarity and finality. Our guest today is somebody who unfortunately knows this feeling all too well. From active early screenings for his hereditary predisposition for cancer, to rolling with the uncertainty of his developed DVT and PE from cancer treatment complications, it takes a level of resiliency only experienced by a few. Please join me in welcoming today my friend, Dr. Michael Philbin.
So we have hereditary prostate cancer in our family. So I was diagnosed when I was 52. So I started screening in my 40s because my dad died of metastatic prostate cancer when he was 57. I was 12 at the time. So both my brother and I were doing screenings well up before that. So my brother he's 14 years older than me. So he was already getting it, getting things checked out and whatnot. So he was, 53, 54. Dad's had it. Now my brother's had it. So I started taking vitamin E with selenium and lycopene and all that stuff. Was that a waste of money for 11 years? Probably. Did it slow it down? Maybe. I don't know. So my PSA went up when I was like 45. It actually went up enough that for a normal man, it probably would have been, oh, no big deal. Don't worry about it. But because of my family history, my dad dying of metastatic disease, my brother having it, did the first biopsy, which of course I was nervous for. And then it came back negative. And then 6 months later, it like tripled or quadrupled. And I thought, oh, this is it. They didn't find it the last time. I'm like, God, I'm only 45, 46. Thought I had till 50 till I had to worry about this. And then that came back negative. Nothing there. And then the PSA came back down. And over the next 7 years, it kind of rose slowly, not a big deal. The urologist I had at the time, his thing was like, your PSA has been kind of steady, but you're 52, your dad's age, your brother's age, maybe we should do another biopsy. So I talk with my wife and family and my doctor, so we do another biopsy. So I was really nervous for the first two, and I go into this biopsy thinking, this is no big deal. It's just sort of to check and make sure things are fine. Nothing's going to happen because the PSA hadn't gone up that much. So technically, PSA screening did not catch my cancer. So based on the amount my PSA change wouldn't have warranted it, but my family history and the age of my brother and father getting it is what warranted the check. And then it turns out I did have prostate cancer. So that's what warranted the surgery. So mine got caught when I was 52. I had a prostatectomy, and they told me that getting a blood clot in your calves and potentially in your lungs was one of the complications of the surgery, and that I should walk around for at least 5 minutes every hour. If I had any pain in my leg, to give them a call. So surgery was on Saturday. On Wednesday, my right calf was kind of sore. It's almost like, have you ever done work where you're standing on a ladder and you're on your tiptoes for a little too long, your calves get kind of sore from that. So it was just like that. It was just a soreness. It wasn't like pain. And then by Friday, it was still sore, and I was taking 6 ibuprofen a day. So I thought, well, it's sore. It doesn't hurt. So I called my doctor, and they called back and said it's probably nothing, but you should get that checked out. Either come into our urgent care or go to your local ER. So I went to the local hospital. Of course, I realized I was a week after the prostatectomy. I was tachycardic, like 115, 120 beats per minute. So they did a echo on the legs, and they saw a blood clot in my left leg. Bear in mind, the soreness was in my right leg. They did not see a blood clot in my right leg. They saw one in the left leg. And they also did a CTA and found that I had a small clot in each lung. They're subsegmental pulmonary emboli. I knew a little bit about the calf pain because once I pulled a muscle in my calf, went to the local emergency room, and they sort of said, well, we don't think it's a blood clot. So I was aware that if you had pain in your leg, felt like a pulled muscle, that could potentially be a blood clot. So just from that little pulled muscle thing, I had some awareness to it. And then it was really the other one. It was the journalist David something or other in the first Gulf War. He was sitting on a tank for 4 days, got off, DVT let loose, and he had a massive PE and died on the spot. So that was the first time, in the general media, that I was aware of it. The next time was one of the women I work with, her fiance was diagnosed with colon cancer, but they got it. Looks like he's going to be okay. They're going to do some treatment. 2 days later, he's dead. It's like, what happened? Oh, he had a blood clot. So there was a time where now I've know somebody that's had a blood clot, and the DVT emboli or whatever thromboembolies went to the lungs, and he died from it. So that was sort of one was in the general media, another was actually someone I know's fiance. So I had some awareness to it. And like I said, that my cancer center, they had made me well aware that it was something to be on the lookout for. When I was in the emergency room, the nurse, she says, I'm telling my colleagues that I've got a patient with 3 blood clots in them, and he doesn't look anything like a patient with 3 blood clots on him. To which I said, well, what does a person with 3 blood clots look like? And she says, they're usually dead. So I said, oh, and I figured, well, I guess I must be doing okay. I knew blood clots weren't a good thing, but I figured I feel okay. I'm in the hospital. They're taking care of me. So while I was in the hospital, it was fine. It was a couple of weeks after my general practitioner's doctor's office called and said the doctor would like me to come in to see me. So I went in. And he said, I heard you had these PEs after your surgery. I said, yeah, it was no big deal. They were small ones. He's like, well, it's a good thing they were. We wouldn't be talking right now. And that was sort of the aha moment of, oh, okay. And mine were below the knee. So those are supposed to be not as dangerous, because the higher up they go, the bigger the vein, the bigger the clot and whatnot. And I think because I had just had within the week of the abdominal surgery, I think they were taking a lot more seriously. And the ER doctor said, if we were in Europe, we'd release you because it's below your knee. They wouldn't even treat it. They'd say, go home. It's only in recent years where they do an echo on it that they can actually see them now. Because I think the older technology, the veins were too low below the knee. They wouldn't even see that per se. My GP told me if you stuck 100 people in a room, I would have been the last one anyone would have picked to have a blood clot after the surgery.
The clotting risks associated with surgery can be terrifying. Knowing that these complications stem from oftentimes life-saving procedures just makes these subdued clotting events that much more nefarious. However, when it comes to being informed, the best you can do to prepare is communicate, inquire, and recognize the risk factors beforehand. Here to discuss the clotting risk for people with hereditary predispositions to cancer and how to communicate risk effectively, from Memorial Sloan Kettering, This is Dr. Avi Leader.
That individual that has prostate cancer, if I were to meet him beforehand, just for discussion about the risk of blood clotting, I would actually tell them that prostate cancer is associated with a relatively low risk of blood clots. The fact that you are at low risk does not mean that you're not going to have a clot, and the fact that you're at high risk does not mean that you're going to have a clot, but it is about probabilities in life, right? So that's mainly for us. I think for us as a group of doctors, physicians, ideally, we would be able to select the higher risk group for more intensive education and prevention, and the lower risk group maybe to save them some of those worrying situations. But I would tell that patient that if they were going to surgery, they should ask the surgeon about prevention of blood clots, because hospitalization and surgery, even if your cancer is a low-risk blood clot cancer, the surgery in itself, you just pull someone off Fifth Avenue here and put them in hospital for 5 or 6 days, and they have surgery and they were healthy, their risk increases. So the surgery is a big thing.
I say this every time, but I feel like we need to clone you because of your willingness to just talk about your whole health experience. We just don't have many men that are so open about things. So it's great to have your willingness to do so. So here's a question for you, because you're so very matter of fact about everything when we chat. And I was like that too when I was diagnosed. And then when I started to do my research on what had happened and when all of the statistics look like, it massively raised my anxiety. What was your experience like when you started to kind of delve into learning about blood clots? Because it's one thing when you're in the hospital and you've got great care at MSK and, oh, hey, you should be aware of the following things. But did it do a number on you at all after the fact?
Yeah, it was more after. Yeah, and actually it was Central New Jersey Hospital that I was at for that. So all my blood clot related stuff wasn't done at the cancer center. It was done locally.
Right,
so,
but the MSK had told you to be on the lookout.
Yeah. That's why I have the surgery. So there, when I called, they said either come in to see us or go locally or whatever. And so
tell us about the after.
Yeah. So like I said, when I saw my general practitioner, at first I was like, oh, they're small blood clots, like no big deal. And then he sort of said, well, if they weren't, then it's a lot more serious. So that was the first aha moment that, that you start learning a little bit more about it and stuff. So I was seeing a local hematologist, the same doctor I had in the hospital. I continued to see them afterwards. So the PEs actually cleared like within a month or two, because it was actually 5 weeks after surgery, right before I was supposed to go to work. And one morning I just felt really weird. I called my wife up to come get me. We went to the emergency room to get checked out because I just felt, and they looked, they didn't see anything. And in fact, the CTA shows the blood clots have now cleared or whatever. So I don't know if it was just a, what they call a vasovagal response or something. It's almost like if you think you're not feeling right, you can almost get yourself into
yes.
I don't know if shock's the right word, but you think something's wrong and there isn't, but it just sort of, so those actually cleared pretty quickly. And I saw the hematologist fairly regularly, and they do the echo on the leg. And again, like I said, the clot that was seen was in the left leg, despite the pain in the right leg. And the clot was sort of still there. So I was on Xarelto for a while. Mainly, and then it seemed like the clot was stable. So after, I don't know if it was like 6 or 9 months or a year or something, went off for like a month. They checked my D-dimer, and then that was still a little elevated. And the whole time my hematologist would say, well, it's risk versus reward. We keep you on it because the reward outweighs the risk. Or, so each time we went through, it was a shared decision-making thing very much. So then I went back on for a while. And so I was on totally for like 2 years, and then finally was off because the DVT and the cap seemed fine and everything like that.
Did you have any concern about coming off of it?
Um,
Were you?
yeah, because I mean, when you're on the anticoagulant, at least it's like, 90 whatever 5% of people aren't going to have a recurrence. There's
Right.
still 5, so it's not 100%. But at least you realize while you're on it, you have very good protection.
Yeah.
Because so I wasn't that worried about recurrence of my prostate cancer, because if I had a prostate cancer recurrence, more than likely, yeah, I'd have to go through radiation. But in terms of it killing you, probably would take a while. Versus you get another blood clot and you could drop dead. So the blood clots were almost kind of and that I wasn't expecting. Like when I was told I had prostate cancer, I'm like, well, I knew this day was going to come. Because a lot of people say they hear they have cancer and they don't hear what the doctor says. I remember every word he told me because I knew that more than likely was going to happen. So it wasn't. But getting the blood clots, that was unexpected. That I didn't expect would happen, nor potentially realize the potential lethality of having a blood clot. I think the conference we were at, I believe they had said 20% of cancer patients get a blood clot at some point in time.
Yeah. It's the second leading cause of mortality for cancer patients behind the cancer itself, which is mind-boggling when you think about it.
Especially pancreatic, I guess, is especially high
Yeah,
risk.
there are certain that are higher risk. Yeah, yeah. I was in the same camp. Like once I started to actually do my research, and I'm a researcher by training, so I was like, oh my god, these numbers. And then I realized how very lucky I was, and how very lucky I was that I got treated relatively quickly. Also, so one of the things that I also wanted to touch on, you've had time to kind of reflect upon all of this, and like you got treated for your cancer at MSK, which is a world-renowned institution. You live in a metropolitan area or close to it, so you can get access to healthcare. You've been a real proponent of your own health, which I think is just so critically important for people, especially if there's a family history. So you have this platform now. What do you say to people, and men in particular, about getting real about your own health care? If you know there's a family history of something, um, how do you deal with it? Like recommendations to Joe Q public about your own healthcare journey, because you really took control of yours.
Yeah. Well, my other brother who hasn't had prostate cancer, he sort of has a saying, how would you like your pain, now or later? And later is usually worse.
Yeah.
So it's easy to, put your head in the sand. And I've done it. Everybody's done it. I don't want to worry about, I'll worry about that later. You kind of, but ultimately catching something earlier is going to be more treatable, less painful or whatever. So I think if it's something at some point when you finally realize, I need to get this looked at, because if you don't, it's going to be worse later on as you do things. So at least if you think of do I want less pain now or more pain later,
But the prostate, it's so interesting. That is something that men should be aware of. And, you are out there, advocating for awareness. So, you've kind of, I don't know if you're the reluctant advocate now, or you're being dragged into it by National Blood Clot Alliance and Memorial Sloan Kettering. But, where do you see this going? You've got, like I said, you've got a platform. People want to hear your story. You have the ability to help influence people think about their health journey in a really good way. Like, how do you see this developing for you?
from the blood clot standpoint, or
All of it.
I mean, from property or hereditary cancer, I also volunteer at Force Facing Hereditary Cancer Empowered. So I'm already doing a lot of stuff with them in terms of the hereditary cancer end of things. So I think it's something like 10% of cancers are hereditary, and usually hereditary is early onset. The average is like 66 for prostate cancer, and early onset's before 55. Much like women with breast or ovarian, see breast cancer in the 30s or ovarian in the 40s and whatnot versus at older ages. So I definitely, work in that camp. And the problem is, like on the prostate cancer, and there's a lot of this, oh, it's overtreated, we don't need to screen anybody, which if you're at average risk or normal risk for a disease, that may be quite true. You're at average risk, maybe we don't need to screen you. But if you're a high-risk individual for whatever the disease is, so, in my case, the blood clot was more a complication of surgery. There are people that have clotting disorders that put them at risk for that. So certainly, if you're in a family where there's a hereditary history of DVTs or PEs and whatnot, that's probably something that, to be aware of, whether it's, do you find out, do you have this disorder or not? Because that is one thing the hematologist said when they checked me. He said, yeah, we did all the tests on your blood and you don't have you don't have a predisposition to blood clots. At that point, I wasn't necessarily aware of, okay, what are all these different disorders and so forth. Once you have one of those clotting disorders, most people are going to know it a lot, more readily. So once she said I wasn't predisposed to it, I really didn't give that end any more thought. But certainly fear of recurrence of the blood clots occurring. So anytime I'd have like some soreness or pain in my calf or my thigh, it's like, oh, is this it again?
Is this it
Do I need
again?
to go to the emergency room? Am I overreacting? Am I so needless to say, a few cases I made an appointment with my hematologist, a couple of days later, then should you be waiting days? But I thought, well, I don't think it's urgent, because anytime anything happens, you think, do I need to go to my local doctor in a couple of days? Should I go to an urgent care center? Do I need to go to an emergency room or somebody you're with? So you always kind of run through what's the appropriate thing, or do you take 2 aspirin and call your doctor and, the famous take 2 aspirin and call your doctor in the morning. So you always sort of look at where do things appear to be and what's the right, step to take and so forth. So yeah, there's a few times where I'd end up going, and probably more than a few times, like after an airline flight, my heart rate was up. Yeah, I had PEs before. So it's like, okay, well, we just want to rule it out because you've had it before. You were just on a long flight, even though I wasn't presenting with any leg pain or whatever, the elevated heart rate was enough that, they did a quick CTA to go, no, there's no PEs in there. You're okay. So it's certainly, I think once you've had a blood clot, and everyone I run into, any of you've had a blood clot already, that puts you at higher risk, you could get another one. So any medical professional I've been to has at least been aware that because I've had one, their radar goes up immediately that, oh, you've had a blood clot before. And they're taking it seriously as to, do we need to rule it out? Is it something that's going on or whatever? And then I think I told you, or I talked about, it was like, I forget how many weeks after the surgery or whatever. And I was at home and I felt a twinge in my thigh. 3 seconds later, a twinge in my lung. And all of a sudden I started like blacking out. And I thought, because it's like, oh, well, the blood clot let loose. It just went to my lung. And again, was that more of a vasovagal thing where you like talked yourself into, and I was starting to go out. I thought I was dying at that point. It was kind of scary. And then it went away and I was fine. It's like if you hold your breath too long, you get a little lightheaded and then and then I was fine. I was thinking, oh my God, what was that? I actually called my hematologist's office. It was kind of late and I forget what they said. And ultimately, because again, do I go to an ER right now? And it just seemed, came and went. I just kept an eye and it was kind of okay. So, I did evaluate, sure, I've been going to an emergency right then and there, but because it kind of came and went, it didn't seem to be, I forget if we had the Apple Watches, and now it's good. You look at the Apple Watch. So every time I go to Manhattan, my heart rate's always elevated.
Hey, I live
So then
there.
you're thinking, all right, my heart rate's 104. I'm sitting on the train. Is anything going on here? And then I do my thing and I come back and then my heart rate's back down. So I'm at least used to, like going to Manhattan, you're usually, it's hustle bustle, watch out for,
That's
crime
hilarious.
things. So I don't know if your adrenaline's up a little bit. So certainly, yeah, any heart rate being up, that's of course more of the pulmonary embolism than a DVT. So you're aware of these things to know to be on the lookout. So it can always be a little, like I said, I had a bigger fear of a blood clot recurrence and dying from that than a prostate cancer recurrence
But
happening.
that's why, your voice is so important to, to us in the thrombosis world, because you've experienced it and you can talk about it, but until you actually experience it, it's a different story altogether. So, I think it's important that, Because VTE, these blood clots, I often refer to them as sometimes they're the bride and sometimes they're the bridesmaid, i.e. they attach themselves to other things like cancer. Using your voice to say, hey, I had prostate cancer, but I also had this. And you guys should also just be aware of this in the event that, you have surgery or what have you, just to make people aware, because that will save lives. And also, if you feel a twinge and you were smart, like go to the doctor, go to the emergency room. I'm glad I eventually went, because my outcome could have been a lot worse. And I was the person who was trying to talk myself out of there was something wrong. And there was something wrong. I didn't know what it was. But I think, always err on the side of caution and rule it out. Just like you were saying, do you want your pain now or do you want your pain later?
And later's worse.
Later's always worse.
Usually.
Later's always worse. So, Michael, I just want to say thank you so much for joining us here today. Your story is amazing, and we're so happy that you're okay. And also thank you for helping us to raise blood clot awareness. It's so important to have people like you doing so, and in particular, to have men who are willing to share their stories, because your story will save lives.
Thank you. It is my pleasure. And usually, everyone wants to hear about my prostate cancer stuff, and the blood clots oh yeah, I had some blood clots, but it worked out okay. So it's kind of interesting to actually now have a platform to actually discuss that part of things, because not everybody's necessarily aware, especially if you have 20% of cancer patients having blood clots at some point. I don't know the percentages of how many become fatal PEs necessarily, but at least, and I guess the lucky thing is if you're in a high risk group, you can look out for it. So it's tougher if you get a blood clot for no reason at all. You don't understand. So at least if you're in a high risk group, you can at
Try
least
to be aware
or monitor or whatever you need to do.
Awesome. Thank you. We want to thank Michael once again for sharing his experience and vulnerability here today. A special thank you to the exquisite Dr. Avi Leader from Memorial Sloan Kettering for his impeccable expertise. Thank you for joining us here today on another episode of Taking a Breath. For more information on risk prevention and community, please visit stoptheclot.org.
We know the patient because we are the patient. Together with listeners like you, we can collectively stop the clot.
Another Everything Podcast production. Visit everythingpodcast.com, a division of Pattison Media. Subscribe wherever you get your podcast.